Every morning, millions of adults across America begin their day with a small white pill. Some take Amlodipine, others take Losartan. Both promise the same goal: to protect the heart, calm the arteries, and keep life moving. But here's what few people talk about. That same pill which lowers your blood pressure may also change how your body feels, how your legs move, how you sleep, how you breathe. So today, I'd like to slow things down. We'll look closely at two of the most common blood pressure medicines, not from the point of view of a lab chart, but through real human stories. Because after 60, medicine is no longer just chemistry. It's biography. Hello, I'm Dr. William Harris. Before we begin, please remember this video and everything I share are for educational purposes only. Always consult your doctor or healthcare professional before making any dietary or lifestyle changes. Let me introduce you to Linda. She's 68, retired from teaching, and loves tending her roses every morning. Last year, her doctor prescribed Amlodipine, one of the most trusted medications to gently relax her blood vessels and lower her blood pressure. Within a few weeks, her numbers looked perfect: 120/75. Her doctor smiled. But by June, Linda began noticing her shoes fitting tighter by afternoon. Her ankles puffed slightly, then more by evening. At first, she thought it was summer heat. But the swelling never really went away. Now meet Tom. He's 61, a retired mail carrier from Ohio. He switched from another drug to Losartan, hoping for fewer side effects. His blood pressure dropped beautifully. But 2 months later, he noticed something else: a dry, tickling cough that just wouldn't stop. It wasn't painful, just persistent. The kind of cough that shows up during dinner or in the middle of a conversation. 2 medicines, 2 success stories, each with its quiet trade-off. That's what makes this conversation so important. Because numbers don't always tell the whole truth. How you feel matters too. Amlodipine belongs to a group called calcium channel blockers. Now, that sounds like textbook jargon. But let's put it simply. Imagine your arteries as flexible garden hoses. As we age, the muscles in those hoses tighten, partly because calcium acts like a signal telling them to squeeze. When Amlodipine blocks calcium from entering those muscle cells, the hoses relax. Blood flows more freely, pressure drops. And that's why doctors love this medicine. It works predictably, gently, and consistently. In studies, people taking Amlodipine saw their top blood pressure number, systolic pressure, drop by about 16 points. That's a meaningful drop. Across a population, it can mean thousands fewer strokes and heart attacks each year. But biology, like life, always asks for balance. Because when arteries widen, veins don't always follow suit. Imagine traffic flowing faster out of a city but not back in. Congestion builds up. That's what happens in your legs. Blood and fluid pool in the lower limbs, leaking into surrounding tissue. Your shoes tighten, your ankles swell. Doctors call it peripheral edema. I call it the body's way of saying, I'm out of sync. According to the Cleveland Clinic, roughly 1 in 10 people taking a standard 10 milligram dose of amlodipine will notice this swelling. Women are slightly more affected. Higher doses make it worse. Other side effects? A light dizziness when standing, we call it orthostatic hypotension, and a sense of sluggish fatigue. For some, a bit of nausea or daytime drowsiness. Most of these are not dangerous. But for older adults trying to garden, walk, or dance at their granddaughter's wedding, they can quietly steal joy. Now let's turn to Losartan, a very different tool with a very different mechanism. It belongs to a family called angiotensin receptor blockers, or ARBS. Think of your blood vessels as hallways lined with locks. The hormone angiotensin II is the key that tells them to tighten, to hold on to salt and water. Losartan steps in and blocks that keyhole. The vessels stay relaxed, and the kidneys gently release extra fluid. So, while Amlodipine works by directly relaxing arteries, Losartan works by preventing them from tightening in the first place. In studies, Losartan lowers systolic pressure by about 14 points on average, slightly less than Amlodipine, but still a major win. More importantly, It brings an extra gift: kidney protection. For people with diabetes or early kidney disease, Losartan helps slow down damage. That's why it's often called a 2-for-1 medicine, guarding both the heart and kidneys. It's generally well tolerated. Swelling in the ankles is rare. Fatigue and dizziness can occur, but are usually mild. So why doesn't everyone just switch to Losartan? Because it, too, has its quirks. The most common one is a persistent dry cough. That tickle happens because blocking the angiotensin pathway sometimes alters enzymes in the lungs, leading to irritation. For some, it's mild. For others, it becomes a daily nuisance that disturbs sleep or conversation. And though extremely rare, Losartan can cause angioedema, sudden swelling of the lips, face, or throat. It's rare, but serious, and needs immediate medical attention. So you see, Amlodipine may leave fluid in your ankles. Losartan may leave a tickle in your throat. Two very different songs, same rhythm of risk and reward. When doctors compare Amlodipine and Losartan, they look at two big things: power and tolerance. On the power side, Amlodipine slightly wins. It lowers pressure by a couple of points more on average. And for older adults or African American patients, research shows it often performs especially well. But on the tolerance side, Losartan shines. It rarely causes swelling. It's gentle on cholesterol, blood sugar, and kidneys. That's why many doctors prefer Losartan for people who already deal with circulation issues or mild kidney concerns. Here's the nuance. If your ankles are already puffy, Amlodipine might worsen that. If you're prone to cough or have had allergic swelling before, Losartan may not be ideal. It's a balancing act, one that depends on the story your body tells. I've often told my patients, medicine is like a tailor-made suit. Two people can wear the same size, but it never fits quite the same. That's why, instead of asking, which is worse, the better question is, which fits me better? And sometimes, yes, doctors use both together. A low dose of Amlodipine combined with Losartan can achieve stronger pressure control while reducing side effects from each. But that combination must always be guided by your healthcare provider. Our bodies are excellent communicators, if we learn to listen. The puffiness in your feet, the nagging cough in your throat, they're not random annoyances, they're messages. Amlodipine says, I'm relaxing your arteries, but your veins are lagging behind. Losartan says, I'm protecting your kidneys, but your lungs are feeling it. Neither is bad. Both are tools, precise, powerful, human-tested. The danger begins only when we stop listening. So here's my gentle warning. Never stop your blood pressure medicine on your own. High blood pressure is called the silent killer because you rarely feel it until damage is done. Quitting suddenly can raise your risk of stroke or heart attack within days. Instead, take note of how your body feels. If your ankles swell, mention it. If you feel dizzy when standing, say it. If you develop a dry cough that won't quit, speak up. A simple adjustment, a smaller dose, a timing change, or a switch in medication can often solve what feels unbearable. Your body isn't betraying you, it's collaborating. Every symptom is feedback. Here's something we rarely discuss: the way our bodies change how we process medicine after 50. Kidneys filter more slowly. The liver breaks down drugs differently. Even our fat-to-muscle ratio changes, affecting how long a pill stays in our bloodstream. That's why the same 10 milligram dose that felt fine at 45 might feel heavy at 65. It's not weakness, it's biology evolving. So when side effects show up later in life, it doesn't always mean the medicine suddenly went bad. Sometimes we simply changed. That's the beauty and challenge of longevity. We live long enough for our stories, and our chemistries, to rewrite themselves. When I help a patient choose between Amlodipine and Losartan, I start with a simple framework. What are we protecting? If the kidneys are fragile or diabetes is present, Losartan often takes the lead. What are we feeling? If swelling or fatigue is already an issue, I lean toward Losartan. If cough or throat sensitivity is the problem, I lean back toward Amlodipine. How urgent is the pressure control? If someone's blood pressure is dangerously high and needs quick reduction, Amlodipine's direct action can bring faster relief. What's sustainable? The best medicine is one you can live with, not just survive on. Now let's step beyond pills. Because medicine is only half the story. The other half is what you do when you don't take the pill. Every meal, every walk, every breath counts. When you reduce salt, you make every blood pressure pill more effective. When you sleep deeply, stress hormones fall, helping pressure stabilize. When you move your body, even gentle morning stretches, your arteries regain rhythm. It's what I call the vitality triangle: movement, rest, and mindfulness. You can't bottle them, but they magnify every treatment. So yes, Amlodipine or Losartan may start your journey, but lifestyle habits will decide how long and how well that journey continues. So, what happened to Linda and Tom? Linda's doctor adjusted her Amlodipine dose from 10 milligrams down to 5 milligrams, added a light diuretic, and encouraged her to elevate her legs in the evening. Within weeks, her swelling eased, and she was back in her garden, pruning roses with her favorite straw hat. Tom's doctor switched him from Losartan to a cousin drug that didn't trigger the cough. He still takes his morning walk, his blood pressure steady, his nights quiet. Neither story is perfect, but both are peaceful because both found balance. That's what good medicine does. Not perfection, balance. So which is better, Amlodipine or Losartan? The honest answer is neither. Each one serves a purpose. Each one asks for understanding. Medicine isn't a one-size-fits-all solution. It's a conversation between science and your story. And here's what I want you to remember. Your health is not just about blood pressure numbers. It's about how alive you feel while lowering them. Keep the dialogue open with your doctor. Ask questions. Bring your observations. And never feel guilty for wanting to feel better. That's not complaining. That's self-advocacy. Keep the dialogue open with your doctor. Ask questions. Bring your observations. And never feel guilty for wanting to feel better. That's not complaining. That's self-advocacy. If you found this episode helpful, give it a like. It helps more people discover trusted health information. Share it with someone you care about. And don't forget to subscribe for more science-backed guidance on living well after 50. Thank you for joining me. I'm Dr. William Harris, and I'll see you in our next episode, where we explore how timing your medication can change its power. Until then, stay informed, stay kind to your body, and as always, add life to your years, not just years to your life.